the Ministry of Sanitation and the Ghana Education Service are partnering to educate students from various special schools across the country on menstrual health and hygiene. Under the Water, Sanitation and Hygiene Service, this initiative will be a significant intervention to increasing school attendance while reducing absenteeism among girls, especially during menstruation. This is also to reduce menstrual stigmatization among students with special needs. There's more in this report.
The onset of menstruation means a new phase for new vulnerabilities in the lives of adolescents. Yet many adolescent girls face stigma, harassment and social exclusion during menstruation. As part of efforts to curb the growing stigmatization among adolescent girls, the Ghana Education Service and the Ministry of Sanitation are reaching out to special schools. The support will include the provision of educational materials on menstruation for the differently abled, especially visually impaired students. Director in charge of School Health Program at the GES, Theresa Opon-Mensah, says heads of institutions and teachers are being trained on how to ensure inclusivity among differently abled adolescent girls.
We intend to support the girls in our schools. And that is why we are giving the teachers the requisite knowledge and skills for them to use the Braille to educate the children in the special schools on menstrual health and hygiene. We have produced materials on menstrual hygiene for years for the normal in quotes schools. And we feel this is a time to also Braille those materials to continue with the education for the special children. And with the help of the Gamma project from the Ministry of Sanitation and Water Resources, we have been able to produce these materials for use in the schools.
Programs Manager at the Ministry of Sanitation, Charlotte Ejimafo, highlighted the need for the project to take off.
We have realized that we have special girls who normally stay out of school because of access to infrastructure, because of educational materials that are not fit for purpose for them, and even stigmatization and discrimination against girls with special needs. So in Ghana we have about 50 special schools, and 10 of them are visually impaired schools. And they use different materials to learn. So together with Ghana Education Service and the Ghana Sanitation and Water Project, which is supported by World Bank, we have been able to design materials that they will be able to, like the brailles for the visually impaired. We do audios and then flip chart pictures. We use the tools that they understand for them to be able to have opportunity to learn about menstrual hygiene management, and then also to support a girl, a special girl, to be able to menstruate hygienically, privately, and then boost their confidence, and they'll be able to stay in school and then learn.
Materials for the menstrual health and hygiene education for visually impaired students will include Braille books, which will enhance their learning capabilities.
This is the book we have Braille for the visually impaired, and we are using for the menstrual hygiene training. This will help the visually impaired to also get full knowledge and information about the menstrual hygiene that is being taught. So it is no more abstract to them, it is very practical to them. So whatever you have for the sighted child, we have brailled it. So if you ask the child what is puberty, the child picks this book and he or she reads and gets the same information as the sighted person.
For Joy News, Nana Boachida Kweyadom, Kumasi.